All right. Good morning, good afternoon, good evening, wherever you are, and welcome to the 7th session of the TechNet 21 webinar series on deploying an electronic eLMIS, making the right choice. I'm delighted to welcome our guests for this session, the topic of which is introducing DHIS2's last mile eLMIS module. Today we have with us three panelists. We have Benno Horch, LMIS technical lead at the University of Oslo, George Maguire, sorry, George, if I mispronounce your name, LMIS Technical Advisor, University of Oslo, and Dr. Priyanka Senanayaka, excuse me, Priyanka, a National Consultant in Digital Health, WHO Sri Lanka. We'll start with an introduction of the tool. Then Dr. Priyanka will present the Sri Lanka case study. We'll finish this session with questions and answers. You can ask your questions during the presentation in the Q&A box or in the chat box. They will be answered by the panelists after the presentation. As usual, this session is recorded, so we'll share later the links to the video as well as the slides by email and on the TechNet 21 website, as well as on our immunization supply chain Telegram channel. Well, Benno, the floor is yours.
Okay, thank you, Alex, for that. So then I will start by giving first an overview of the DHIS2 platform, the context in which it works, the features, and then the community around it, and lastly, the eLMIS tool. I will go relatively quickly. There's a lot of content to cover, so please follow up with questions and also contacting us afterwards to clarify any points that might be unclear. And then, of course, I'll hand over to Dr. Priyanka for a explanation of their tool in Sri Lanka, followed by George Maguire, who will do a demo of the aggregate data capture. So DHIS2 is a platform used to capture, manage, and analyze data in a generic sense. It's a flexible platform with many uses, which I'll go through. It's open source software, so there's no fee for the software itself, and it's maintained, developed, and managed by the University of Oslo and the DHIS2 project there. It's extensible through web APIs and an app framework, so you can actually connect it and use it with other systems and develop native apps. And of course, as I mentioned, based at the University of Oslo with a very broad global network, which we call the HISP network, so the Health Information Systems Program Network, based in different regions, which I'll also show you. So quickly in numbers, DHIS2 is used by over 300,000 users in over 90 countries, by many NGOs and also global organizations. This is the global adoption. It's actually increased even through the COVID-19 pandemic, which has pushed for even more use cases and increased the need to use it for as an HMIS, so capturing health data. But just to highlight that it's used by over 60 countries on a national scale. And also to highlight that the adoption has been progressive. It's been incremental improvements to the software itself, and then implementations. It was not an overnight implementation across 60 national and 150 organizations, but it was a slow development over the past decade and a half. And this is the model that we'd like to continue with, is to make these incremental improvements also within now LMIS. Key areas, and the main, of course, is HMIS, so capturing health data and supporting health programs. But there's a lot more with disease surveillance and other areas within health. And then also outside of health for water and sanitation, logistics, education, agriculture, and many different uses where the platform is used, being that it's a generic platform for capturing, storing, and analyzing data. As I mentioned, implemented by a large number of NGOs and supported by global and regional organizations. And then the funding for the development and maintenance of the software is done by these major donors to the University of Oslo. So there's no, again, fee for the usage, but rather you're ensured that this software is maintained and updated through the direct funding which we receive from these donors. Now, moving on to the software itself, and this is maybe a key point, is the different data models which we have for capturing data. So there's the first, on your left, the aggregate data model. So this is a report-based data capture and analysis. It can be daily, weekly, but generally monthly data capture and reporting. And this is the first use case for our LMIS module that we capture stock data on a monthly basis. We also have an event report, which is used to a limited extent for LMIS, mainly for registering items received at a facility, so shipments being received. And then there's a third model using longitudinal data. So you have an entity, it can be a patient, a client, and in our case, of course, a stock item, which you track transactions and its life through the health system from when it enters to when it's distributed. So that's based using our tracker tool to track items on transactions. So we have our report-based aggregate model and our transactional model using tracker, and I'll get to those later on when I showed the LMIS use cases. With this data, you can then create within the system visualizations to analyze your data as needed, and then develop dashboards. And these can be made available at both local level where the service, the point of service and the items are being distributed, and then aggregated to a national level at the Ministry of Health, the central level, where you can then have aggregate data and analysis to inform both supply chain and health program management as well. You can create thematic maps and have different layers of data covering geographical areas. And you can also have your event data being captured over the same maps. Now, it's a highly flexible tool, and all of this can be configured as needed. So everything from the analytics to the data capture can be highly configured. And it's also available on mobile. So we have our Android apps to both capture data in all of these three data models and to also provide the same charts, maps, and analysis and the dashboards which are available on the web version. You can also have that on an Android mobile app. It's not available on iOS, but it is for Android, and it provides full offline capability. This is just some screenshots quickly of the mobile app, the Android app, where you would manage different programs, enter data, and in the case for logistics is managing stocks received and stocks issued. Just a quick snapshot or a picture of a program in South Sudan using the tracker app, and also in a field setting where you have full offline capability. In case of difficult connection or connectivity, you can run your program, and then once you have connection, the system will synchronize with the main servers. To add to the point of configurability, we also develop what we call metadata packages. So this is a standard configuration. Since everything is configured and can be changed, it can also be time-consuming and almost intimidating to have all of that work in order to have a program start. So what we have also done is, in cooperation with WHO and other partners, is developed packages that have standard configurations capturing data and providing indicators and analysis and dashboards that are in line with WHO standards and others to be able to start a program. And this can be a starting point for how you want to capture and analyze your data. And we're actually working on one for LMIS, where we'll have some standard data to be captured, some indicators that can be shown, so that you have a starting point and not and don't have a clean system from scratch to be able to configure and deploy. Additionally, we have the HIS network. So this is a community of dedicated staff that work very closely with the ministries of health in different countries and with different implementers to ensure that proper configurations, servers are running as they should, and that users or implementers have the support that they need. So these are expert groups in these different countries and regions, which are able to support any implementation. We also have our online community where we have discussions from everything from implementation to development and app development. And this is quite a strong community supporting different cases. We have our academies, which also we've had our first LMIS Academy in end of 2020, and we'll be planning another one for 2022, where we have both in person, in countries, in different languages, but also online courses to be able to develop skills to be able to use and implement the system. As I mentioned, it's an open and interoperable platform. So this is one of the major aspects of using DHIS2 is that it can work with different systems, capturing different data, and both sharing and receiving data from other systems, including the other eLMIS platforms, which were previously featured in the webinar series. and it's extensible through apps, which can be developed for specific reasons. And these are available then through the App Store, which then leads to our end user stock management tool for effective logistics management and improved health service delivery. So this is the work which we have done starting earlier this year, is really to capture the stock data work that has been done with DHIS2 in the past years, and trying to develop a common approach or a best practice to using DHIS2 for eLMIS. Now, to be very clear, we're not developing DHIS2 to be an end-to-end logistics management tool. This is not a supply chain management solution. It is really an end-user stock management tool, which we ideally want to integrate with a professional supply chain management or logistics management tool like the other eLMIS platforms, all of the ones that have been already featured in the series. And in that way, we cover this end-to-end supply chain management challenge. So some key guiding documents, there are others in academic literature as well, but just to highlight two, it's the Gavi target software standards for vaccine and supply information systems, and also the country guidance on selecting eLMIS from Global Fund and Gavi. And some key points which they highlight is the question of end-to-end visibility within the supply, real-time data, transactional, but also report data, interoperability with health information systems, and this is relatively easy when DHIS2 already is the health information system. So the data is stored in the same location, and then some cold chain monitoring capabilities. So these are sort of key points which we are looking at and looking to solve at the facility or end user level. And now to give you our view or our vision of how this can be deployed, one way that it can be deployed and what we're coming as the sort of best practice for use of DHIS2. If we take a generic representation of a health structure in a country, from your central level down to your point of care, the community health worker, hospital, or health center, DHIS2 can be used then at all levels for gathering health data, storing and analyzing it, aggregating it to the upper levels. For the logistics information, so your left-hand column there, we see it being used only at this facility level for capturing data and analyzing it, showing it again to these persons at the facility level at the point of service. But then you have your national full-scale system, your professional logistics system managing everything from sourcing and procurement to warehousing to distribution. And then this is integrated with DHIS2, which through a direct integration using APIs, or which is the case, let's see, in Laos with mSupply, where we have this type of one-to-one integration, or through an interoperability layer, where we have an example in Malawi, where we integrate with OpenLMIS and share data between the systems in this way. So this is where we see the advantage of using DHIS2, where it may already be present within the health structure. It's already being used by a community health worker to capture their health data. What we would do is simply add an additional data entry screen to capture their stock on hand, stock issued, and some very basic data, which can then be shared with the national system. And you don't need to roll out another application, any more hardware, and any more training for these users, but they're using an app which they already have access to, with devices which they already have access to, and they're familiar with in the same type of data entry screens. And in that way, you quickly access the stock data in a digital fashion. This integration may also happen purely for accessing health data, and that's a request that comes from many ministries, but here we're discussing using it for capturing stock data in addition. Now, the three use cases which we have, to quickly go through these before handing to Dr. Priyanga, is the first is simply using DHIS2 mobile app at this point of service represented here, hospitals, community health worker, or health center, to capture stock data. There's no integration with any upstream system if it's not present, or if there's no integration need. And then this data can be analyzed together with health data, and you have a digital record from your facilities. The second use case, which is more recommended, would be the same report-based stock data capture at this end user level, integrated with an eLMIS, which can then have accurate, timely data to plan and forecast distribution and distribute to facilities based on their accurate consumption. You also have in both models the ability to have some analytics and dashboards for those end users. And then the third and ideal, let's say best case, would be using the transaction-based system to capture data at the facility level. This would provide real-time data, again, integrated, and you would have immediate alerts when you have an order level, when you reach an order level for any specific item, and also incorporating cold chain management, so managing temperatures from cold chain equipment and having that connected to the system and to alerts, which would allow for you to conduct any kind of error follow-up or a corrective action. Now, a final summary before I hand over is, again, on the right side is the end user level that we use DHIS2 mobile to do the stock management, limited order management. Again, that's being done by the upstream system, but you could visualize that and have some of that available for the end user. You have your performance management dashboards, cold chain management, and then some track and trace and product catalog information are also features that would be useful at that level. All of the full-scale professional supply chain system features would be in the upstream system, and we would simply select which data needs to be transferred from system to system, and also at what level you decide to implement the DHIS2 solution, and at what level, what volume of activities, transactions, and items at which facility you would want to have your full-scale system. So that really is our vision and our view of where you could leverage the use of DHIS2, which may be present already in country, running to capture health data, and then integrate that with a system. So then DHIS2, a flexible generic platform using open source technology, already widely used as an HMIS, as I highlighted in the introduction. It's already being used to capture stock data and has been for well over 10 years in many countries. Right now for COVID-19 vaccine delivery, 14 different countries are using it simply for COVID vaccines. And what we then are promoting and developing, both in connection with the different eLMIS platforms, but with other partners, is to develop these guidance and guidelines for the best use case for DHIS2, which is keeping it at the facility level and to integrate it with a professional logistics management system for both your supply chain and your health program management. All right, so that is a summary of the points which we want to share with you. Please, we look forward to answering the questions specific to that, but right now I'll hand over to Dr. Priyanka Senanayake in Sri Lanka, who will quickly share the stock monitoring component which they developed there. Dr. Priyanka.
Okay, thank you very much, Bruno, and thank you very much for the TechNet team to giving me this opportunity to share our experience in Sri Lanka with regard to using DHIS2 platform for logistic management. So I'm just elaborating on COVID-19 immunization tracker in Sri Lanka. So the stock monitoring component of the tracker. So basically COVID-19 immunization tracker consists of two components. The component one is to record individual persons who are taking vaccines. So that's a tracker component. And the second component is COVID-19 stock monitoring component. So I'd like to highlight this component, stock monitoring component, is not a full-fledged stock management component, but it's just a stock monitoring component. So we used this development to monitor our stocks at various stages. Yeah. So in our stock monitoring component, now we have 3-level data entry points: national level, regional level, and vaccine center levels. At each level, we record the receivings and issuings. So because now this was a sort of a countrywide implementation in few actually days. So the training was a challenge. So we had to confine our development to basic areas and also to make it very simple for users to use and enter data. So this is basically the workflow. So we capture from the central store, we capture stocks, and regional store, we capture stocks, again receivings and issuings. And also from the vaccine centers, we again capture receivings and stock balances. So that is the blue color arrows shows the stock monitoring component, and the orange color arrow shows the individual data tracking or the immunization tracking component. Just to go through, so this is the this is the data entry screen for national level. So that is for using that is for recording receivings. And next one is again a very simple form to record distributions from national level to regional level. And then the regional level. So this is the regional level acceptance or receivings. So in gray color boxes, you can see the numbers they have sent from the central level to the regional level. You can tally those figures, whether there's a deficiency or discrepancy in between the number sent and number receiving. And next, the number issuing from the regional level vaccine stores to vaccine centers. Then we move to the vaccine centers. Yes. So in the vaccine centers, again, we are recording the vaccine receivings. Again, same format as in the regional stores. And next, at the end of each vaccine session, we are reporting or we are entering data into the system on available or remaining stock balances. So these are the only data we are capturing in our system. So with this simple set of data, we have generated a number of indicators which are very useful in managing or basically monitoring these vaccine stocks at each level. So the dashboard you are seeing on the screen is national level vaccine stock dashboard, the first part. And so I'm not going to go into details on this dashboard. You can see in the dashboards the wastages, the vaccine stocks by type, and vaccine stock received by type, and also a GIS map to show the distribution from the central store to the regions. So next is also a part of that same dashboard. Okay, so that is national level dashboard. So then the regional level dashboard. So here is in the regional level dashboard, again, some sort of similar information is there now. The vaccine stocks, receivings, issuings, any wastage rate, the breakdown by product. So those kind of essential information which are necessary and which are very helpful for health managers to take decisions on vaccine movements or vaccine distribution is there in our dashboard, and our dashboard are populated with those information. So this is the regional level dashboard. Then we have again a set of dashboard for vaccine center level. So what we are seeing is vaccine center level dashboard. These are all not with real data. So that's why you see very few numbers. So these again in the vaccine center level dashboards, you can see again whether there's any discrepancy in receivings and issuings, the issuing patterns, according to the priority groups by product, and the lots remaining on hand, and receivings, issuings, everything. So this is the next is again a part of vaccine center level dashboard. So those are basically dashboards we have developed out of those very few data, right? Okay, so again, I want to highlight that. So the component we developed here in Sri Lanka with as a component of COVID-19 immunization tracker is not a full-fledged stock management system, but a stock monitoring component, because for stock management purposes, so there's a separate a dedicated system which is being used by the government. And it is possible to visualize by vaccine product, but not by vaccine batch number and expiry date in our setup. So for that, they are using their existing system. So this is basically the overview of our vaccination stock monitoring component of our information COVID-19 vaccination tracker. So thank you very much for giving me this opportunity, and thank you very much all for hearing me. Thank you.
Okay, thank you very much, Dr. Priyanga, and then we'll quickly go to George Maguire, who will do a demo of the stock data and some dashboards as well.
Okay, thank you, Breno. I'm going to share my screen. Okay, what I'm sharing now is the DHIS2 Capture app. So it's a mobile application that you can download for free from the Play Store. So our vision is that eventually healthcare facilities will be using mobile devices to enter data directly at facility level, as Breno pointed out, in order to avoid paper and avoid having delays of sending paper records upstream. So it's all kept very simple. So you can see that at the top, you can see it's Cardinal Hospital Gateway, PHC. So this is part of the sandbox, the name of the facility. You can see that the data is collected for October 2021. And above, you can see DHIS2 end user eLMIS prototype. So that's the name of the monthly report that you can all customize freely. On the left side, you have a list of items, and I take the opportunity to answer the question from Libby on how many items can you easily manage. So we are working on a pilot in one country with 4 hospitals, 23 clinics since almost 1 year. And the hospitals use lists of around 400 items. So they have the full range of medical supplies, surgical supplies, laboratory, diagnostic imaging, X-ray supplies. So DHIS2 is flexible. You can use this only for a very specific program, like Dr. Priyanga showed. You can use it for COVAX vaccine. You could use it for EPI immunization, only for malaria, only for TB, or you can use it for all the stocks that are used in a primary healthcare facility or in a hospital. So we envisage that the hospital would be using up to 400 or 500 items, so without problems. So again, this is what the mobile device looks like. So you have the stock received, stock distributed, stock on hand. We basically just click in the window, it will open the keyboard and you will type in the numbers. And then you can also record the number of stock out days as a frequently commonly used indicator. And then you have you can also record the stock that was discarded because it is expired, it was damaged, and you can also make stock corrections in case at the end of the month your stock doesn't balance between the actual stock on hand and the theoretically calculated stock balance. So we have put all the columns that you will fill, usually will fill, like the stock on hand and the stock distributed on the left side, hoping that the stock discarded and stock corrections will be rare and that you don't need to swipe left and right too much. And as mentioned, you can extend that table downward as much as you would like. And as you have seen in the previous presentations, this specific metadata package that we hope to launch soon comes with a dashboard that you can also view on your mobile device. Of course, the size is limited, so I will not go through the details, but just show it to you quickly. So first, you can see an overview of the data that you have that is entered every month, but you can view that in a historical for the last 3 months or the last 6 months, depending on what you would like to configure. Then important for the quality of stock management is to record the difference between the stock on hand as calculated at the end of the month and the stock balance that is calculated from the previous stock on hand, the receipts, the distributed, discarded, and so on. And you can see here that there's a few discrepancies, and you can see basically the direction, whether you have too much or too little stock, and which should normally be corrected. So ideally you should not have any stock discrepancies, because at least the next month they should be corrected. Then you have a chart with the stock out days, so you can see for every month of the year you can see the number of stock out days, and then when you click on the item, you can actually see which item is affected. So in this case, clotamoxazole, you had 3 stock out days in January and 1 in April, for example. So that's quick. You have a single chart summarizing all your stock out days as a primary logistics performance indicator. And then on the chart on the right, you have the number of actual stock outs. So these are the number of items that had 0 stock at the end of the month, not during the month, but only during the monthly stock count. Again, as a time series so you can look at the trends over the last month. And then you have indicator that is commonly used by logistics, which is the coverage time. So that is the stock on hand divided by the stocks distributed during the previous month. And here you can see this is a bar chart, a histogram. So the number of items that had no stock, 1 month, 2 months, 3 months coverage time, and so on. So that gives you a good overview, especially if you have several hundred items, you will have one chart that gives you a good overview of the health of your stock. So whether it is rather understocked, it's rather overstocked, you have many stock outs or not. And then on the right side with this line chart, you can see the same, basically the same chart, except you can see the history of the last 12 months, so that you can also determine whether there's any trends. If you click on it again, it will highlight, because of course the chart on the left is just a snapshot from the previous month. But if you want to see whether there's kind of a systemic problem that your stocks are constantly over or understocked, or you have a lot of stock outs, then you can consult this histogram. And then I will show you very briefly, again, not go into detail, but just to mention that, of course, all of this information and the dashboards are also available in the web portal. So the same data entry form that I have shown on the Capture app on the mobile device is available on the web portal. If compute is available for particularly at district and national level, and the same dashboard that I just showed you on the mobile device, it will also render very nicely, of course, on one screen in the web portal with the same information. Okay, I leave it with that. Thank you for your attention.
Thank you very much, George. Dr. Priyanka, Breno, thank you very much for this very rich presentation. We have some questions, so please don't hesitate to ask your questions in the Q&A box or in the chat box. Let's start with the questions in the Q&A box. How many inventory items can be easily managed in the system?
I think the short answer to that is a few hundred to 1,000 items. So the quantity of items may not be the limiting factor, but rather the advantage of having the system run in a site that has over 1,000 items. One of the key points to discuss is where you would set the line for reporting within DHIS2 and where you would want to have your eLMIS running. So one aspect is that of what the benefit is, but the short answer is over 1,000 items would be possible to manage within the system.
Thank you, Breno. Dr. Priyanka, can you monitor batch and expiration dates for each vaccine product?
Yeah, actually, it is possible. Now, it is possible to track any item. So, if you include the batch and expiry number, the system consider it as a separate item. So, in Sri Lanka at the moment, we are not tracking these batches and expiry date through this system. But we supported as WHO country of Sri Lanka, we supported Timor-Leste WHO to implement their component, their vaccine system on DHIS2-based vaccine system. So in their system, so they have some sort of expiry date and batch involvement in the stock monitoring. So the short answer for that question is yes, that is possible.
Thank you, Dr. Priyanka. Next question. Currently, which African countries are using eLMIS as a national tool?
Do you mean, I assume it's using DHIS2 to capture LMIS data?
Oh, yes. Yes, sorry. Yes, yes.
I don't have off the top of my head, but there are quite a few of them. I know that in, for example, in Uganda, they're using it quite extensively for capturing stock data within DHIS2, providing analysis with health data. And there are quite a few. I can create a list here now actually and share in the chat, but I don't have the specific names off the top of my head. I will get that and share.
Okay, thank you, Bruno. And to stay in the geography questions, why DHIS2 is not covering Pacific areas?
DHIS2, it can be used and implemented by any entity who wants to use the tool. I mean, it's widely used for health information data. So it's really up to the country to choose that as its solution. The focus is for lower middle income countries. So there's no, I don't know if it's an implication that it's used in conflict areas, but there's no aim to focus on those countries. It's used in Norway actually for COVID-19 surveillance in many of the counties. So it can technically be used anywhere, and there's no limitation to where it can be implemented based on the setting of where it's implemented.
Mm-hmm. Thank you. Question from Ibrahim. Thank you for the good presentation. When are we expecting DHIS2 in the Pacific area? So that's the same one. And how does DHIS2 link with MSupply?
Yeah, sure. So with MSupply and also with the others, what we have tried to develop is just to ensure that we can share data, necessary data on the stock positions using the API connections, so that they access the API endpoints within DHIS2 and pull data once stock reports are submitted. There's also some work to be able to ensure that when stocks are distributed from the MSupply system or other systems, that it can be automatically received without having to do manual input in DHIS2. So it's more or less developing and making available these API endpoints to be able to pull and push data when an event happens and when reports are made. Like I mentioned, in Laos, there is an active integration with MSupply, and there's potential for other contexts as well. So this is, I would say the technology side is not the most difficult part. Really, it's aligning the objectives of where you want to use DHIS2, where you will use MSupply, and how that will go together from a more programmatic standpoint. But the technology itself is relatively straightforward.
Thank you, Bruno. Well, Ibrahim is asking again if it can be used in Pacific, then what could be the requirement to kickstart using it? You're very highly awaited in the Pacific areas.
Oh, yeah, sure. So we have our HISP, actually a Vietnam group as well. Perhaps Dr. Priyanga, if you have supported any of the Pacific context, but in that region, I think in Vanuatu or perhaps a few other, there have been some requests, maybe more particular to COVID-19 recently, but if you want to get in touch with us directly, we can discuss on how to share more information and put you in contact with people that can help you to explore the possibility. Dr. Priyanga, I don't know if you've had contact with any of these contacts.
No, so his network is not working only in their countries, but they are extending their support to other countries also. So through his network, I think you can initiate the thing, and then you can develop your expertise and your competence in country competence, and to more establish the system. So I think it's a doable thing.
Thank you, Dr. Priyanga. I think George wanted to say something.
Yes, thank you. I'm not sure whether Libby was just a comment or a question concerning the, I was curious to also understand how the user interface works and the level of effort for staff to work through the screen to enter 400 items. So what I can confirm that we have 4 hospitals that are entering data for about 400 items every month, and that is working well. I mean, if you enter your data onto paper sheets, you also have a long sheet. Indeed, you will have to scroll. You will have to scroll through a long list. One advantage of DHIS2 is that as soon as you enter a value, it is stored on the mobile device, so you don't have to save click a save button every time. So everything you store is saved, and there's also opportunities, possibilities to customize the screen if it's long, and maybe you have different stores in the hospital. You have different people working on the monthly stock count. Maybe there's different people working on the vaccine store and in the laboratory. You can group your data entry form into different sections. In principle, if you had different stores, you could also separate your list and have a separate monthly report for your vaccine store, for your laboratory and your pharmacy. So there's ways of facilitating the data entry. But generally, so far, the feedback is that people are happy with using tablet PCs. Maybe it takes some time to get used to it compared to just recording the data on paper. But keep in mind that you have to record the data only once, while if you record it on paper, usually the document will have to be transferred to another person, and usually you will have to enter that data in a computer in order to calculate your monthly stock replenishment. So it's certainly faster to enter it on a mobile device a single time, even if it may take a bit longer initially than on paper. Thank you.
Thanks, George. I hope that this answers your question, Libby. We have some questions in the chat box. Lenin would like to know the awaited question: what is the cost for software and development of this product, of the HIS2? Breno.
This can be a slightly, maybe we can take a few tries at this one, because this is a slightly tricky question in the sense that there is no cost. It's open source software available entirely online on GitHub. So you have access to all of the code, and you can implement this with no cost from our side. Also, the development, updates, maintenance of the software is done by the University of Oslo through direct funding. So there's no fees or charges for that. Whenever we release new updates or new features, new software patches, security patches, that is always free of charge. Now, there is a cost of implementation. You need to run a server or pay someone to run a server for you. You need to have the cost of the devices, the training, the cost of configuring the system according to the needs, and all of that, the scope and how broad the implementation is will influence what the actual costs. We do have an indicative budget on our website, which I can also share in the box. But for now, the question is, the answer in a sense is there's no cost, but you do need to have your own infrastructure and some resources to be able to run and maintain the system. I don't know, perhaps Dr. Priyanka, you might have some more specific information you can share here.
Yeah, of course, Bruno. Software cost also, that is for development cost, will be zero now. For an example, now in Sri Lanka, the whole entire COVID-19 immunization tracker system was deployed without any cost. Sri Lanka supported to the government, and WHO also supported the government. So, and overall, the cost was zero for the software development. As Bruno very correctly mentioned, now for any system, you have to bear the server cost and implementation cost, training, those kind of things. So, but in Sri Lankan context, I also would like to highlight that now this DHIS2 platform is being used for several purposes here. So the health workers at ground level are somewhat familiar with the system, so that the implementation and training cost of a new implementation or a new component would not be that much of a challenge, because now we developed this COVID-19 immunization tracker. So both components, the individual immunization recording components, the tracker component, and the stock management component, stock monitoring component, within month. I mean, maximum it took about 1 to 2 months to everything to configure. So that is another very big advantage that when the time is very less, again, the cost of the staff you are putting into is going to be very less. So basically, Bruno very correctly answered the question. So there's no direct cost of software development as long as you develop your in-country capacity to customize the platform. So it's a very simple thing, though there are enough academies to get the knowledge to customize the platform, but all the other costs like hosting and everything, so those will be there. So those are there for any other system also. So I think I answered the question. Thank you.
Thank you. George, you wanted to say something if it's on the same topic?
Yes, it's on the same topic. Thank you. I just wanted to comment that the cost will also depend on whether you are already using DHIS2 as an HMIS system in the country. As Breno has shown the map, DHIS2 is already used in almost all African countries, for example, because a significant part of the budget will be setting up, hosting a server, and the training, of course. And there's a big difference if you have health workers at clinics and hospitals who have been using DHIS2 for some years every day, then it's fairly easy to add a form on stock management. But of course, if DHIS2 is not used in the country at all, then there will be higher costs for the training. Thank you.
Thank you, George. Breno posted something in the chat box about the budgeting guidance documents for COVID-19, which is also indicative for other programs, and a link to a budgeting tool, as well as a list of country in Africa, limited list of countries capturing stock data in DHIS2. Thank you, guys. The next question, also in the chat box, how can we avoid a lot of conflicts if we capture this information from low level as health facility, for example? This person is saying that they use OpenLMIS in Mozambique for record movement from health facility using Android app, and they sync to web portal. Probably this question is for George. No, it's a technical one, unless Breno, you want to say something? George.
I'm sorry, I'm not sure I fully understand the issue of discrepancies. I mean, ideally DHIS2 would be linked directly with OpenLMIS, which is possible. I don't know, Breno, maybe you.
Yeah, having had some limited contact with Mozambique, I think there's at least 2 different OpenLMIS instances that I know of covering different programs. So I think the ideal, if I take this a very broad answer to a specific question, is that what we promote with George and I, and what we've been working on, is to have a approach of a holistic supply chain management using a professional tool like OpenLMIS, and then capturing then stock data in DHIS2. One key there would be to not overlap the data capture and to not overlap the features to avoid any kind of conflict. If you would have some data captured already within the eLMIS tool, there's no need to do that as well in DHIS2. I don't know if that answers to the question or if it's something very specific to the context. We can try to speak about that afterwards and speak to also our HISP team in Mozambique. But if I understood the question, it's more about, again, setting that line where, or that limit where you run your eLMIS up to a certain point within that health structure, and then below that you would run DHIS2 without having overlap but sharing data. So sorry, it was somewhat of a broad answer to a specific question, but we need more information on the case to be able to give a better answer.
Thank you, Breno. So I would recommend, who asked this question, sorry, that's Momad Meji. I would recommend you to contact Breno or to contact the team by email if you want to know more about this specific topic. I'm going to share by email with everybody who registered the link to the recording as well as well as the slides, and I will join an email address so that you can contact them for more information. Good. Thank you very much. Next question. how to, well, this one is a bit technical, perhaps, how to manage data with that computer and use some paper to scan, report, and send to a server and save on DHIS2. How to correct? That's the question.
George, do you want to give that one a try?
If you want me to repeat,
yeah, I'll try. I mean, I have no experience like with scanning data rather than entering data. We know that it is still very common practice to collect data at the end user level on paper and then transmit it physically to, for example, the district level where somebody enters the data. And I know that's easy to say, but our concept is basically to promote the use of collecting data directly at facility level on mobile devices. I realize it doesn't answer the question immediately. Again, if we could, Brenna and myself could look into that, but we believe that collecting data on paper and sending it, maybe facilitating data entry by scanning is a good solution to collect end user data. But ultimately, if you want to have an efficient supply chain system and you want to manage your stocks efficiently, we believe it's inevitable that sooner or later you will need to collect the data directly at the facility level on mobile devices. We realize this could take years. It requires funding. It requires projects, programs, projects. But we believe this is basically, where countries should try to aim for mid to long term, rather than investing resources into let's say, workarounds that are probably not very sustainable. Thank you.
Thank you, George. I see Chris Wright is raising the hand. Probably, Chris, you want to ask a question. I will give you the possibility to ask a question orally. But before that, Brenno, I see all the links and information you shared in the chat box is only shared with the host and panelists. So you might need to change to everybody. And can you please share again all the information? Thanks a lot, Brenno. Chris, I'll give you the mic. Chris, so you need to unmute yourself and you can speak.
Yeah, thank you, Alex. I wanted to address the last two questions. On the scanning technology, there is actually, I think it's out of South Africa, there's a technology company that has developed what they call Smart Sheet, and that is an optimized paper report. So in order to use it, you need to redesign your reports. And then the technology actually captures scanned data from that report, whatever report you want. It can be a stock card, it can be an eLMIS report, it can be an HMIS report. But it does capture and then digitize the data that was written into the report. So that is used in South Africa and I think a few other countries. But I would agree with Brenno that that's sort of an interim solution. We're definitely going towards a complete digitization at the health delivery level, service delivery level. And so I look at the Smart Sheet as an interim solution. Regarding the question on Mozambique, I think the question, as I interpreted it, was, should Open LMIS be used at the facility level, or should DHIS2 be used there for LMIS? And really, that's the decision for the program and the country to take as to how they envision data collection for various purposes at the health care level. There is good reason to say use Open LMIS at the health facility level, because it's a very direct way of using an integrated LMIS. But there's also a good justification to say use DHIS2 as your single app. It's the only app that's used at the healthcare level, and then it sends the stock data to OpenLMIS as Breno had described. So it really depends on what the vision is for working at the health facility for the health workers themselves. And there's no right answer. There shouldn't be a conflict. There just should be a rational, objective process for deciding what the best approach would be. Thank you.
Thank you, George. You wanted to say something?
Yes, thanks a lot for that, Chris. I mean, I just want to fully concur. I mean, Brenner and myself, we are not trying to compete with any of these excellent systems that have been developed over many years that are very highly sophisticated, almost as good as an ERP or as good as an ERP, and which we can only recommend. Our mission is really to connect the last data mile. If that is already done, if you're already using OpenLMIS or another tool, that's fantastic. That's a great step ahead, and you can congratulate yourself. I just want to add to Chris that one way of looking at this issue is also you could also differentiate by the type of healthcare facility or the size of the healthcare facility. So I would certainly agree as a logistician that if you are running a large hospital and you're maybe managing 2,000 products, you probably want to use OpenLMIS or mSupply or Medexis, and might even want to manage at the batch level. But if you are working in a clinic and you don't have a dedicated logistics team, then you want to minimize the work for the health workers. And maybe if you are managing a malaria or TB program, you might only have 20 items. And DHIS2 is already anyway used for HMIS. So you would have the synergies. You will not, you spare the resources of implementing a sophisticated tool at clinic level or even at the community health worker level, where they would probably use a very small percentage of the functionality. But again, really the mission is kind of a global one to digitize health supply chains. And we are collaborating very closely with all of these developers that are named also in the document that Brenner showed, and we are really looking forward to having many more projects with them to integrate where it is needed. Thank you.
Thanks, George.
Thanks, George. And I'm sorry, I referred to Breno when I should have mentioned it was you who had answered those. So thanks, George. Sorry, Alex, go ahead.
No problem, thank you. Breno, you wanted to say something.
Yeah, I was going to segue actually to answer the question from the anonymous attendee, but I think George stole my thunder. He really answered it there, saying that the question is most healthcare workers fill in other sections of DHIS2 and often not input stock data. What can be done to improve reporting on stock data? Should the DHIS2 have obligatory field to ensure all inputs have been included? Now, it's exactly what George just said. If they're already using DHIS2, they're familiar with the application, they're using it for capturing health data. What we're recommending then is, in that case, it would be efficient to include the stock data as well, and they would capture that, and with an integration, that data would be available to the upstream, the professional system, to then have accurate consumption data and to manage stock. So that was really well answered by George just now.
Thank you. Well, there's another question. Hi all. Do you capture transactions in your system?
So I'll take that question. So the answer is, in what we have presented today in what we call the basic mode in the aggregate form, the answer is no. This is purely monthly reporting system, replacing the paper with a digital system. We are also working on what we call the advanced mode, for which a prototype is being developed. Hopefully it will be available for testing end of the year. So we hope that next year this advanced mode will be available. And that system works in a way where you actually have no reporting to do anymore. So that also follows up on the question on Libya, and like entering all this data for like 400 items. Is this practical? So in the advanced mode, all you need to do is to scan a barcode for an item and record whenever you issue the stock from your pharmacy to a ward, to the operating theater, or to a dispensary. And then all the other calculations are done in the background automatically. But I caution you that we envisage that this advanced mode that does capture all the transactions in real time will only work efficiently if you are integrated with an upstream national eLMIS like mSupply, LMI, OpenLMIS, Medexis, or others. But we are definitely working on that. And just as a preview, maybe for 2024, we are also thinking of developing a transactional system that will actually use the GS1 data matrix code so that you can actually capture the batch number and the expiry date with your mobile phone or your tablet PC scanning. And then you will have, as was, the question was raised earlier, then you can manage your stocks via the batch and the expiry date level. So we are definitely working on that, but that's quite complex and it will take some time to develop. But appreciate the question. Definitely, the transactional mode is the way we are heading for. But we also believe that digitizing the last data mile is maybe is a big step. It requires resources, training. You have to maintain those devices. So we think that if countries implement the basic mode, then you lay the groundwork. And if people are comfortable with the basic mode, then once the advanced mode is available, then for the facilities which want to upgrade, it should be fairly easy to do because all the devices, the training, the server, and the software is already in place to do that. Thank you.
Thank you, George. Bruno, Dr. Priyanga, George, do you have a few more minutes? I mean, we have passed 4 o'clock, but there are maybe 1 or 2 more questions. Is it fine with you?
That's fine.
Okay, great. So next question from Libby. What are your views on data entry validation? How can countries check that the data was entered correctly?
Okay, it's a good question. The question, basically, if you look at the basic mode on the aggregate report, my standard question is, how do you manage on the paper system? So DHIS2 does allow data validation, but the only criteria that we have is that the data values have to be 0 or positive integers, except for the stock corrections, which can be negative or positive. So yeah, maybe Libby, if you can type better what your requirements on the data validation would be, that would be interesting for us to learn. I think generally that's very difficult to kind of check whether the entries are correct. Maybe one thing that I showed briefly in the dashboard is that you can check on the spot, even in the basic mode, even working offline, you can check whether the recorded stock data adds up. So you're basically taking the stock on hand from the end of the last month, will be written to the beginning of the next month. Then you will add the receipts, add the stock distributions, subtract the stock distributions, subtract the redistributed, subtract the stock discarded, and that will calculate the value. And that value has to balance with the stock on hand. So if the discrepancy is 0, then you have a good chance that all the values were entered correctly.
So you have more information, George, from Libby. Data validation. I'm thinking about randomized double entry of 5% of data to ensure that there aren't too many typing mistakes. For example, 100 entered instead of 10.
Okay, thank you. I had not thought of that. There's only one data entry form in our current system. So if you basically cannot enter data for the same facility for the same month, but I would suggest that you contact us bilaterally and we discuss the requirements and we can see what we can learn from that. Data validation is indeed something that is very common in DHIS2, but that we have not explored in detail for logistics yet.
Thank you, George. So Libby will just wait for, expect my email in a few days, and there will be an email address that you can use to reach George and Breno and Dr. Priyanka directly for your questions. Maybe a last question. So this one is also perhaps technical. What about metadata packages for DHIS2?
Sorry, the question was.
Sorry, let me repeat that one. I'm not sure if it's relevant to you. What about metadata packages for DHIS2?
All right, so we have developed metadata packages for, as I mentioned in the presentation, in cooperation with WHO and other partners to define clinical case definition for management of different programs, health programs. And what we're currently developing then is an eLMIS metadata package, which would be a starting point then for capturing stock data, providing some indicators and analytics. It's very much the same which George also presented. It will be based on what he showed there, and we hope to be able to publish that by end of this year, at the latest first quarter of next year, to have also trainings, webinars to promote and disseminate that. And these can be used across programs, and then of course adapted for your specific needs. It's difficult to have something which will be immediately applicable to all programs, but this will be a starting point, defining data elements and building some standard dashboards which can already be used. So this is very much within the approach that DHIS2 has had within different areas within the HMIS field, and we'll be applying the same for eLMIS.
Excellent, thank you, Breno. So I think we have more questions, but it's already almost 4:10. So we can wrap up. Thank you very much for your time and for this very rich presentation. I know there's much more to say about DHIS2, and but we're limited on time. So I would like to thank you again. And as a reminder, we'll send everybody the links to the recording and the slides by email. They will also be made available on the TechNet 21 website. You can already register for the last session of this series that will take place next week with Chris Wright, who's with us today. This is a panel discussion, which is what's the right solution for you? I think this is going to be a really interesting discussion. I'm going to share the link with you to register. Will be also sent by email. Thank you again. Thank you, Breno, Dr. Priyanka, George. I wish you all a very nice day. I wish all participants a very nice day or evening, and see you again. Bye-bye.
Thank you. Bye for now.
Thank you, everybody. Thank you.
Bye.